We would normally do this with 2 nurses, one person to perform the procedure and one to assist and monitor the patient. This should be done via a clean technique, and we would normally do this every 12 hours. You will need a 100 ml bag of 0.9% sodium chloride at room temperature, a 60 ml Luer-Lock syringe, a suction unit with a Yanker suction attachment, and a towel to protect patient's neck and chest area and bed linen from spillage. Make sure you explain the procedure to the patient, even if they are sedated. Check that cuff pressure is at the required level of 20 or 30 millimeters of mercury, and increase by 10 millimeters of mercury if desired. Flush the subglottic port with 5 ml of air just to make sure it is clear. Fill the 60 ml Luer-Lock syringe with 50 ml of normal saline and attach the syringe to the subglottic port. Slowly instill the normal saline over 3 to 5 minutes, and at the same time use the Yanker to remove the accumulating fluid from the mouth, or occasionally the nostrils, and from the stoma site in the tracheostomy patient. Ideally, one nurse should instill the saline and one nurse should suction. Note any change in the cardiac rhythm and saturation readings. If there are any changes, abandon the procedure and do not instill any more saline, and then administer suction via the ET tube. Continue to instill saline, and it should be a minimum of 50 ml and can sometimes be more than 200 ml. You should do this until the fluid suction from the mouth becomes clear. When all the saline has been instilled, remove any remaining secretions by aspirating the port over a 10 to 20 second period, or until the flow of secretions ceases. Dispose of all aspirated material in accordance with hospital policy, and send a sample to microbiology if required. Remember to decrease the cuff pressure if you have initially increased it at the beginning of the procedure. Document the completion of the irrigation procedure in your notes, and then any dressing or tube holder tapes become wet during the procedure. These should be changed after the procedure is completed.